Okay, we're on to Module 2 now, where we're going to talk about the clinical features and diagnosis of gynecomastia. Let's start with the signs and symptoms of gynecomastia. Plain and simple, it's defined as enlargement of the breast, so we're going to see more breast tissue on a male than he had previously. Generally, there's a firm area that can be palpated directly under the nipple and areola, and it favors the upper outer quadrant portion of the subareolar area. There's often a little bit of tenderness associated with gynecomastia, and the axillary lymph nodes may be enlarged. Remember, there was a component of edema that we saw on the pathology slide. This is reflected in mild adenopathy. We expect that with gynecomastia. Here's an example of a male with gynecomastia. You can see there's definitely enlargement of the tissues bilaterally. The nipple and areola become more prominent. This is a pretty well-developed example of gynecomastia. If your eyes are sharp and if your eyes have been wandering, you can see he has a little scar on his neck. He has a little scar on his upper abdomen. Makes me think perhaps he has had a TIPS procedure, has some liver problems. So that may be the cause of his gynecomastia, altered metabolism due to liver disease. So what is the purpose of mammography in gynecomastia? Why do we do it? Well, we do it because usually it can help us differentiate gynecomastia from cancer. And one of the ways it does that is that it shows that the condition is bilateral, even though clinically it might not have been apparent because it may be very asymmetric. So if we see that it's bilateral, that makes cancer much less likely. So in this patient, he has gynecomastia on both sides, this proliferation of tissue, but it's clearly asymmetric. There's more on the left than there is on the right. But the fact that there is some on the right makes it much more likely to be benign gynecomastia, not cancer. So we can avert biopsy in this gentleman. Now we're going to talk about the mammographic findings of gynecomastia and pseudogynecomastia. So we'll start with pseudogynecomastia first. Remember that pseudogynecomastia is not true gynecomastia, but we see just fatty proliferation. So we see a fatty mound of tissue, like in this breast, just dark fat, no subnipple density. The subnipple density we see on this side, where there's true gynecomastia. But we can just talk about pseudogynecomastia on this side. So there you see a nice contrast. Here's another example of a patient with pseudogynecomastia. We see fatty tissue on both sides. And just to keep it interesting for you, you may have seen these small masses, several of which you can see are on the skin. This is neurofibromatosis as well. All right, now we're going to move on to the mammographic findings of true gynecomastia. True gynecomastia is where we have proliferation of ductal tissue under the nipple. So we talk about three different patterns of this subnipple radiopaque tissue. We talk about nodular, diffuse, and dendritic patterns. But all three of these are characterized by a smudgy kind of density that fades into the surrounding fat. And we'll show lots of examples of that. So we'll begin with the nodular type of gynecomastia, and we use several words to describe this. They're merely descriptive words. We talk about discoid nodular gynecomastia. Looks like a little disc here, a little spaceship kind of shape. This is a fan-shaped gynecomastia of the nodular type, and you can see both of these are characterized by a concentrated density right under the nipple. And then there's the button type of nodular gynecomastia. You can see it's called that because it's very dense and round, looks like a little button. In this gentleman, it's symmetric. So I'm pretty confident that it's gynecomastia, not cancer. But you can imagine that if it was only on one side, it would be very difficult to distinguish from cancer. So these are the ones that often need biopsy to prove it. The next type of nodular gynecomastia we call flame-shaped. There's a lot in the literature and teaching about flame-shaped density being indicative of gynecomastia. So we're going to talk a little bit more about what a flame looks like, because sometimes this is where people go down the wrong road. So here's a nice example of a small flame-shaped area of gynecomastia. They're little tongues of tissue that flow out into the fatty tissue right under the nipple, like this little flame here. Here's another one with a little bit more flame. You can still see the flames coming out here into the fat, but there's no dense central mass. And this man has practically a bonfire here with lots of flames, but still the same characteristic of wispy tissues flowing out into the fat without a dense central mass. But this is not a flame shape, right? This is a ball. This is a mass. This is a cancer. So we don't want to be tempted to call this flame shaped just because it's under the nipple in a man. If this was in a woman, you would have no problem saying, there's a ball, there's a mass, I'm worried about cancer, I need a biopsy. Okay, that was the nodular type of gynecomastia. Now we're going on to the second type of gynecomastia, which is the diffuse type. And this is the one which really mimics female breast on mammography. Here you see in this example, the man has bilateral gynecomastia. You could call it flame shape on the right, but on the left, if this was a female, you wouldn't hesitate to question that this is normal breast tissue. You wouldn't even think it might be a man, but this is a man with the diffuse type of gynecomastia. Excuse me, he presented with a mass on the left, and you can see that what he's palpating there is the whole breast, which is just full of proliferating tissue. We can confirm this appearance with ultrasound. We'll talk more about ultrasound later. But when we do ultrasound in these, they just look like normal breast tissue like you would see in a female. Here's another example of a patient with asymmetric diffuse gynecomastia on the left. It's very dense. This man has had gynecomastia here for a while. It has become quite confluent, and again, looks very much like a female, but this is diffuse gynecomastia, asymmetric in a male. Okay, so that was nodular type, diffuse type of gynecomastia. Now we move on to the dendritic or fibrous type of gynecomastia. And this is the type which is more extensive and more confluent, radiates deep into the adipose tissues, and can become more chronic. Yes. We're going to talk more now about the mammographic findings of true gynecomastia. It's usually bilateral, but may be very asymmetric, and it can be unilateral. And as we showed with the diffuse type, if it's very extensive, it can be indistinguishable from the female breast with a large cone of ductal structures. Remember, the males don't have lobules, but they have a lot of proliferating ductal tissue. So here's an example of a 61-year-old who came in for a lump in the right breast, and we mark lumps with the BB on the skin like this. There's a BB on the skin, and you can see there's what we call a focal asymmetry under the nipple on both of those views. We're going to do some spot magnification views in this area to get a better look, better compression. Here we have our spot magnification views, and we see that we have little tongues of tissue going out into the fat without a dense central mass. Again, you see the fat infiltrated here. So this is benign gynecomastia. We don't need sonography here. We don't need a biopsy. We feel comfortable calling this benign. Where else might we see gynecomastia? Well, on everybody's favorite exam, the CT. At least in practices around here, we do lots of CTs. And if you're observant, you'll begin to see gynecomastia, like in this patient. If it looks symmetric like this, you may mention it on your report, you may not, but nothing more really needs to be done. However, if it was very asymmetric and it looked like this, you might consider that there could be a cancer there, and so you might recommend correlation with mammography and or ultrasound. Okay, so that's what gynecomastia looks like. What is the course of gynecomastia? What can we expect? Generally, it's self-limited for conditions of a transient hormonal imbalance, like in puberty or around middle age. And usually, it will resolve if the cause can be removed. Like if a patient is taking a drug, which they can stop, you can try stopping the drug and see if it goes away. But if the gynecomastia goes on for time, they take drugs that they can't stop, whatever, then the stroma becomes hyalinized, and that results in the fibrous type of gynecomastia, which may become chronic. And in order to remove it, the patient would have to undergo surgery, which sometimes men do. It isn't necessary, but if they want it to go away, sometimes surgery is required. Thank you.